Let's dive right in. The most common material used for final teeth with all-on-4 full-mouth dental implants is monolithic zirconia. Now, zirconia is a great material, and this is what most offices offer as their top-tier material. And these are the reasons people like it. It's very hard, and it's a very dense material. And as a result of this hardness, it is very stain-resistant and easy to clean. So it's great for red wine or coffee drinkers, and it looks amazing. Now, there are a couple of things to note with this material. It is the heaviest material, so when comparing solid zirconia to other options, you can really feel the heft of this material in the hand, and that worries some people. But honestly, you don't really notice the weight in the mouth. Now, the second concern for some is the sound. If you restore both the upper and lower arches with full zirconia, the sound of the material coming together is a very tinny or glass-like sound. Now again, for most, this is not an issue once it's in the mouth, but I do want to just point that out. Now, for me, as a dentist, the biggest concern is where this material connects with the implants. Because of the hardness of zirconia, it makes it more susceptible to shearing fracture in an area like this where it connects to the implants, where it gets a little bit thinner. And the key to the long-term success of your all-on-4 is maintaining the health of the dental implants, because the dental implants are to your new teeth what the foundation is to your home. So we want this to be a nice, passive, solid connection. So this is a model here representing someone's mouth with 4 implants placed. These little attachments here are what we call multi-unit abutments. So this is a little representation of a multi-unit abutment. And this is the main concern for me, where these two meet and come together. We want this to be a very sound, solid, secure fit and a passive fit. So if we get a little fracture, and I'm going to put an image up here of one that's sheared off, what can happen when it shears is it allows some little micro movements here, which can then kind of be like a domino effect and travel around and cause problems, with the other connections, and then that can lead to bigger problems in the future. So, what is the answer to this problem? The answer is getting something like this. It's a solid titanium bar with a full zirconia overlay. So basically, you're getting with this all of the benefits of the full zirconia, the looks, the stain resistance, and the cleansability, plus you're getting the added strength of the titanium bar or the foundation, because this solid titanium bar is virtually indestructible. It's not going to fracture or shear. This means the implants are all going to be bound by this rigid framework, and it's going to help ensure their long-term success. And a couple of added benefits is it's going to take away some of that weight. The titanium bar makes it a little lighter, and it's also going to help deaden some of that glass-like sound when those teeth are coming together. Now, to me, this option is kind of the sweet spot when we're discussing final materials, but this is something not all offices can offer because they don't have the machinery to mill or fabricate the titanium bars. This is a billet of solid titanium. Now, not all offices have the capability of milling this out. You have to have certain machinery that does it. And I'm proud to say here in this office, we do have that capability. And because we can do all of this in-house, we can offer this option for the same price that most offices are offering the zirconia alone. So if you're in the market for all-on-4 and you've been looking at the full zirconia, I hope you can see the advantages to having a stronger framework and, as a result of that framework, having a better implant connection by using solid titanium. Now, if you have any questions, feel free to give me a call, schedule a consultation with me. I'd love to meet with you, discuss your options, let you look at these models, answer any questions you may have, and I hope you found this video helpful. Thanks for watching, and I look forward to seeing you soon.